Today we'll discuss about medical surgical nursing subject. Topic is glaucoma. Introduction. Glaucoma is one of the leading causes of irreversible blindness in the world and is the leading causes of blindness among adults in the United States. The glaucoma eye. In the right you can see healthy eye. Definition. Glaucoma is a group of eye conditions that damages the optic nerve, or glaucoma is characterized by high intraocular pressure that damages the optic nerve. The definition of glaucoma is a group of eye conditions that damages the optic nerve. Another definition is it is characterized by high intraocular pressure that damages the optic nerve. Means here optic nerve is getting damaged. Incidence. Glaucoma can occur at any age but is more common in older adults. It is one of the leading causes of blindness for people over the age of 60. Classification. Based on onset, congenital glaucoma, acquired glaucoma. Based on cause, primary glaucoma, primary angle glaucoma, primary close angle glaucoma, secondary glaucoma. The onset, congenital glaucoma. It's a rare condition when a congenital defect in the angle of the anterior chamber obstruct the outflow of aqueous humor. Means it is a very rare condition. How it will occur means because of anterior chamber obstruction only it will occur. That time the flow of the aqueous humor is difficult. That's why it will come. Acquired glaucoma. It is developing during the lifespan. Based on cause, glaucoma may occur as primary or congenital disease or secondary to other causes such as injury, infection, surgery or prolonged use of topical corticosteroids. Open angle glaucoma, angle close glaucoma. Primary open angle glaucoma. It results from overproduction or obstruction of aqueous fluid through the trabecular meshwork or canal of Suchmund's canal. Primary close angle glaucoma. It results from obstruction to the outflow of aqueous humor. This obstruction caused by anatomically narrow angle between the anterior iris and the posterior corneal surface closing the angle. Absence of trabecular meshwork. Causes and risk factors. Family history of glaucoma. If you see the race, African American, older age that is 60 years, diabetes mellitus, cardiovascular diseases, migraine syndromes, nearsightedness that is myopia, eye trauma, any injuries to the eye, prolonged use of topical or systemic corticosteroids in eye. They are keeping. These are the main causes and risk factors to get glaucoma. Pathophysiology. There are two accepted theories regarding how increased intraocular pressure damages the optic nerve in glaucoma. The direct mechanical theory suggests that high intraocular pressure damages the retinal layer as it passes through the optic nerve head. The indirect ischemic theory suggests that high intraocular pressure compresses the microcirculation in the optic nerve head, resulting in cell injury and death. Clinical manifestations. Mild to severe headache, pain in eye, increased intraocular pressure more than 25 in case of POAZ, increased intraocular pressure more than 40 to 70 mm of Hg in case of PCAZ, photophobia, visual disturbances, corneal edema, discomfort around the eyes, difficulty in adjusting the eyes in low lightening, loss of peripheral vision. Assessment and diagnostic findings. History collection. In history collection, we have to ask the patient family members is having any history of glaucoma. Any diabetes mellitus, cardiovascular problems, any migraine, these are we has to collect in history collection. In physical examination, any photophobia is there, visual disturbances, headache, eye pain, this everything we will be seeing, and also edema you can be seeing. Next, diagnostic finding, tonometry to measure the intraocular pressure, ophthalmoscopy to inspect the optic nerve, gonioscopy to examine the filtration angle of the anterior chamber, slit lamp examination to know the sight, perimetry to assess the visual fields, prevention, regular eye test, known family health history, wear eye protections, take prescribed eye drops regularly, manage. Although treatment cannot reverse optic nerve damage, further damage can be controlled. Lifelong therapy is needed, almost always necessary because glaucoma cannot be cured. The treatment goal is to maintain an intraocular pressure within a range unlikely to cause further damage. The aim of all glaucoma treatment is prevention of optic nerve damage through medical therapy, laser or non-laser surgery or a combination of these approaches. For open-angle glaucoma, initial treatment aims to reduce intraocular pressure by decreasing aqueous humor production with medication. This includes beta blockers, that is Timola, used occasionally in asthmatic clients or clients with bradycardia. Epinephrine, contraindicated in angle closure glaucoma. Myotic eye drops, it causes pupillary constriction. Angle closure glaucoma requires immediate treatment to lower high intraocular pressure. Initial drug therapy such as acetazolamide, pilocarpine, IV mannitol or oral glycerin. If the patient has severe pain, treatment may include narcotic analgesics can be used to decrease the pain. The medication phase to decrease the pressure, laser iridotomy or surgical peripheral iridotomy must be performed on emergency basis to save client's vision. Surgical management, trabeculoplasty. Procedure is indicated when intraocular pressure is inadequately controlled by medications. In laser trabeculoplasty for glaucoma, laser burns are applied to the inner surface of the trabecular meshwork to open the intratrabecular spaces and widening the canal of Suchman, thereby promoting outflow of aqueous humor and decreasing intraocular pressure. Next is you can see laser iridotomy in case of PCAC, cyclocryotherapy, that is freezing ciliary bodies in case of POAC. Nursing management. Monitor the client intraocular pressure regularly. We have to check the intraocular pressure, how much is there. After surgical affected eye by applying an eye patch and eye shield. After trabeculectomy, give medications as ordered to dilate the pupil. Administer prescribed pain medications. To relieve the pain, we have to administer astrologer. If severe pain is there, even narcotics also has to be used. Reduce the fear by explaining and health education. Psychological support. Patient education. It focuses on maintaining the therapeutic regimen for lifelong control of a chronic condition. Emphasizes the need for adherence to therapy and continued care to prevent further vision loss. Provide education regarding use and effects of medications. Medications used for glaucoma may cause vision alterations and other side effects. The action and effects of medications need to be explained to promote compliance. Provide support and interventions to aid the patient in adjusting to vision loss, potential vision loss. Nursing diagnosis. disease. Acute pain related to increased intraocular pressure. Disturbed sensory perception. Visual related to altered sensory reception. Self-care deficit related to decreased vision. Anxiety related to partial or total vision loss. Risk for injury related to decreased vision. Impaired home maintenance related to decreased vision. Deficient knowledge related to medical regimen disease process due to no prior experience. Nursing interventions. The patient is taught how to administer medications and performs a written demonstration to ensure that eye drops are administered properly. If the patient has trouble with a steady hand when administering eye drops, teach the patient to rest his or her hand on the forearm to steady the hand. If the patient is unable to see the label on the eye drop bottle, consider large print labels or audio tape directions. For patients with multiple medications, consider using large multicolored dose stickers placed on medications bottle with a considering direction card with a matching color dot. Patients are taught the need for having regular eye examinations through dilated pupils. The complications are blindness. How you can be as being the patient, a person of glaucoma, the lifestyle and home remedies is to prevent this glaucoma, eat a healthy diet, exercise safely, limit caffeine consumption, sip fluids carefully, take prescribed medicine. Thank you. Thank you for watching and thank you for spending your valuable time.